Hello, my name is Heather Milan and I'm here to do a chest tube dressing change today. So I've reviewed my physician's orders so I know which patient I'm doing it for, what I'm doing, which is the dressing change, that it's due now, and that the reason I'm doing it is because the current dressing has been on for a little while, so it's time to switch it out for a clean one. So I'm going to wash my hands and gather my supplies. And now that I've gathered all my supplies, I'm going to head to the patient's bedroom. So I'm going to do a safety check upon entering, making sure there are no hazards as I enter the room, and I'm going to introduce myself. So hello, my name is Heather Milan, and I'm the student nurse that's going to be changing your chest tube dressing today. So there's no hazards, so I'm going to put down my supplies, and I'll go verify that I have the correct patient. So I'm going to verify verbally and by checking the wristband, so I know I have the right patient. So I'm going to explain the procedure a little bit. So I'm here to change out the dressing that you currently have on your chest tube insertion site. So I'm going to remove the dressing. I'm going to clean the site with normal saline. I'm going to assess the site, and then I'm going to add a new dressing on top. Do you have any questions? Alright, so I've verified that my patient is in a comfortable semi-Fowler's position, and I've exposed the site that I need for the procedure. So he's all good to go. I'm going to wash my hands and begin to set up my supplies. So I've got my dressing tray here. And I'm making note of my 1-inch border, so I'm going to be careful not to contaminate those within those during the procedure. I've set up a garbage bag at my feet, and I've already prepared a sterile drape for the patient, so I'm going to be using that one instead of the one that comes in here. So I'm going to go ahead and dispose of this one. And I'm going to remove my sterile forceps from the tray. And tip to tip, I'm going to push them within the 1-inch border so I can access them when I need them. And I'm going to add some things into my sterile tray. So I'm going to add my normal saline, which is brand new, never been opened, and not expired. So I'm going to gently pour that in. And I was careful not to drip on my sterile field, so I know that I did not contaminate it. I am also going to add in my Jelonet dressing. And I'm going to add in some IV drainage sponges. Alright, so now that my sterile field is all set up and ready to go, I'm going to apply some clean gloves so I can remove the dressing that's currently on my patient. In the clinical setting, these would be new gloves, so they would be a lot easier to apply than these ones are. There we go. So now I'm going to gently remove the dressing that's currently on my patient. Careful not to tug on the chest tube as I do this. And I'm now going to assess the dressing that I just removed from the patient. So I'm not noting any foul odor coming from the dressing. I'm not noting any drainage and any blood. So I'm going to be sure to document that all after the procedure. So I can dispose of this. I'm going to dispose of my contaminated gloves, and I'm going to wash my hands. I'm now going to remove the Jelonet dressing that's currently on the patient. And I'm going to dispose of this as well as the forceps. I can wash my hands again. So now that the dressing is off the patient, I'm going to assess the site. So I'm not noting any foul odor now that the dressing is removed. I'm noting that the peri-wound skin looks pink, dry, and intact, and that there's no drainage around the site or blood. So now that that is good to go, I'm going to begin to clean the site. And I'm dipping it in the normal saline and then using my forceps to squeeze off any excess normal saline. And I'm going to begin at the insertion site and go in a circular motion. One sweep, and that one is garbage. And now I'm going to clean some of the peri-wound skin as well. And now I'm going to clean the chest too. So I'm going to do one sweep along the top of the chest tube. Oops, that came apart, so I'm just going to and I'll do one sweep along the bottom of the chest tube as well. Alright, so now that the area is cleaned, I'm going to dry the site with some gauze. Alright, so now that the insertion site has been cleaned, dried, and assessed, I'm going to go ahead and add the Jelonet dressing right on top. So I'm going to form this into a tube shape so I can snugly place it around the site. Alright, so now that that is snug and completely occluding the insertion site, I'm going to add the drain sponges. And I'm just using my sterile forceps to touch the sterile part of the gauze to make sure that it's fully occluding the insertion site. And now that those are in place, I'm going to add a 4x4 on top. And now I'm going to tape down the dressing. So I've pre-cut some tape for myself. I'm going to tent over the chest tube to keep it in place. Alright, so now that the dressing is fully occluded and the chest tube has been tented over, I'm going to write my name, date, time, and designation onto the dressing itself with another piece of Mefix just so that they know, the next nurse that comes in knows when I did this dressing change. So I can now put the patient back in a comfortable position with the bed in the lowest position, and I'll make sure the call bell is in reach, and I'm going to remove all my hazards from the room and all of my garbage. And I'm going to do an exit safety check as I leave, so I haven't left any hazards, call bells in reach, and I'm going to be leaving to go document. So what I'm documenting is what I noticed when I took off the dressing from the patient, so that there was no foul odor, drainage, or blood. What I assessed at the site, so that the peri-wound skin was pink, dry, and intact with no blood or drainage at the site, and what kind of dressing I put on top, as well as the time and date of the dressing change. So that is all going to be documented, and I'm going to leave now.